Let's talk about how to assess a patient following self-harm. Probably the patient cut herself or did another type of self-harm. So how to assess self-harm? A patient presents to you with this self-harm, and the first thing we do, we assess the patient's injuries. We have a medical assessment, and this medical assessment is done to identify any serious disorder that might need a medical treatment. Maybe she has bled a lot, and that's why she needs admission, treatment to repair her wounds, and blood transfusion. So that would require an urgent medical admission, urgent admission. So after urgent admission, we give the medical treatment. We give the medical treatment. And after stabilization, we do a psych evaluation. We have to do a psych assessment to identify the level of behaviors, to identify the risk of suicide, to identify the overall ideas related with the patient's self-harm. So in the psychiatric assessment, we will evaluate the current attempt. We will also evaluate the background, and we will have a general assessment of the suicide risk. So in the evaluation of the current attempt, we have to take the patient's own account. What actually happened? And what was the intent of the patient? That is very important. Did she or he wanted to kill himself or just wanted to injure himself? What is the method that is used? Is it a violent method or is it not that violent? What is the intent right now? So what was the intent during the event, and what is the intent right now that he is in hospital? What he or she thinks? Does she think that he did wrong, or does he think that he wants to do it again, or he wants to go one step further? And we have to assess for any psychiatric symptoms such as delusions, hallucinations, any anxiety disorder, depression. We have to assess for that. So those are the things that we have to have for the current attempt. Take the patient's account, assess for patient's intent, degree of intent during the event and after the event right now in the hospital. What is the method? And if there is any psychiatric symptoms or signs. We also have to take the history of background of the patient. And in the background, first, we have to take any history of previous attempts. If there is any previous attempts of similar types of self-harm. If there is a personal history or family history of similar events. What is this level of social support for the patient? What is the social support for the patient? What is the level of drug abuse? If there is any alcohol abuse or drug abuse history in the patient. And obviously, we have to assess for the acute suicide risk. So what are the risk factors that increases the chance of acute suicide? And the risk factor can be remembered by a simple history of a specific person. Let's think about John. John is a 65-year-old depressed man, depressed, alcoholic man who has lost everything. He has lost his wife, his wife died, lost his job, and now he is living alone in the streets, with multiple medical problems. He had bad knee joints, he had renal disease, and he tried to kill himself before, tried to kill tried to kill himself before, and now wants to have another go, at this. He wants to kill himself again. And he has written that he wants to kill himself in a paper, in a cigarette paper, that it's now or never. He is going to do that now. So what are the risk factors that we can identify in this simple history? First of all, the patient. The patient is an older male. So old age is a risk factor. He is depressed, so he has a psychiatric illness. He's a man. That is another risk factor. Alcoholism is a risk factor. Living alone, he is living alone. And he's unemployed, lost his job. He has lost his wife. So recently he has lost his wife. This is a bereavement. And he has many illnesses like knee disease, osteoarthritis, and renal failure. So chronic physical ill health is another risk factor. He has previous attempt. That is the most significant risk factor. And he has a written plan of how he is going to kill himself again. I mean, how he is going to try again. So those are the risk factors for suicide. So where we were in the assessment of a patient with self-harm. And the step we are in right now, we have done a psych assessment, the current attempt, the background history, and we have assessed the suicide risk of the patient. And after those psychiatric assessment, the next step will be plan according to the assessment. If the assessment has indicated that this patient has a high risk, of suicide, we have to plan to minimize the risk. We have to plan to minimize the risk. We have to plan to minimize the risk. And how do you do that? We have to remove the methods of self-harm, such as removing any sharp instruments, removing any firearms from the vicinity of the patient. So remove. We have to arrange for social support. And if the patient is acutely suicidal, we use the mental health legislation to admit the patient in a psychiatric facility. Okay, so we have to admit the patient in a psychiatric facility, and we can also have a specific psychiatric service for outpatient treatment.